Good morning, ladies and gentlemen, and welcome to the final day of the ICT&health World Conference 2026. It is fantastic to see so many of you back, and I also know so many new faces because today's a special day. We've really focused today's content, among other things, on the topic of nursing. So I know there are quite a few nursing professionals here in the room that have just come for today, and it's fantastic to have you. Welcome to you here in Maastricht. So, as mentioned, today's focus is on nursing, but it's not the only focus. We're also going to explore European perspectives, international perspectives on the future of healthcare. The content, however, on nursing itself has been curated in close collaboration with our friendly neighbor from around the corner, Maastricht University Medical Center, plus one of our main partners, and we're very, very grateful for them to really have made sure that this content is right at the intersection of the practice itself and also of the future of healthcare. So very excited for some of these nuggets that we're going to pick up over the day. The reason nursing is so important is because nurses sit at the intersection of care delivery, workforce pressure, and digital transformation. If change is meant to work on the ground, then it has to work for them. It has to work for nurses. Now, if you want to see what innovation and practice in the nursing profession looks like, I very much encourage you, as you step out of this auditorium and you go to the steps down into the area with the many different booths and innovation spaces, to take a direct left after the steps, and then you'll meet many nurses and other professionals from UMC Plus who will show you different innovations in the field. And I encourage you to really take a look and to see for yourself what's happening. I met a roboter that was going around and learned something about delivery of different things that are relevant. So I encourage you to do the same. It's really fun. You're going to learn something. Now, from this starting point, today's conversations will extend, of course, also into other areas, into leadership, into system resilience, into how policy and technology can make a tremendous difference in supporting healthcare to become better across borders and across care settings. And that is really where we're also going to start with our first keynote. I'd like you to put your hands together for our first speaker, Martin Dorazil, Deputy Head of Unit in the Digital Health Unit of DG Santé. Martin Dorazil, please welcome on stage. And I'll just... Perfect.
Good morning, everybody, and thank you for a kind introduction. It's a real pleasure to be here with you in this beautiful city of Maastricht for this important conference. And I would like to use this opportunity to share with you a few thoughts or a few elements of the European policy in the era of digital health. And I'm really glad that I was given this opportunity to open the day today because this event brings together those people that matter the most when we talk about digital health solutions, and their use. Healthcare professionals alongside health policymakers, innovators, and health system leaders. That mix is essential because digital health policies will only make sense if they are grounded in clinical reality. So with that in mind, let me use these few minutes that I have available to share with you where we stand in the European Union with regard to digital health and digital health policies. I would also like to take the opportunity to explain a little bit how our flagship, let's say, initiative, the European health data space fits into this broader picture. And above all, I will also try to explain and demonstrate why this all matters for your daily practice and especially for our patients and for patient outcomes. So let me start with a very simple point as a way of introduction. Digital health, data, and AI are very powerful, but there are not policy goals in themselves. They are and they should be approached as tools, and they only make sense if they help healthcare providers and health professionals do their job better, to improve patient outcomes, and strengthen health systems under pressure. Across the whole Europe and the European Union, we observe many challenges being faced by healthcare providers and health professionals, including shortages of health workforce, increasing burden of chronic diseases, aging population, rising expectations from patients, ironically sometimes driven by the digital technologies, and also growing administrative complexity of health systems. The European Union's digital agenda is not about technology for the technology's sake. It is about supporting care, reducing friction, and building systems that learn and improve over time while fully respecting our common values, our European values of trust, safety, solidarity, and human oversight. This all means that we believe in a healthcare system that can be at the same time innovative, competitive, improve health outcomes, and also leave no one behind. So with that introduction, let me now move to the recent flagship initiative of the European Commission and the European Union in the area of digital health, the European health data space. The European health data space is often described as a data regulation, but also bearing in mind what I just said a minute ago, that would be too narrow. The European health data space is a major world-first structural reform of how health data is going to be used in Europe for provision of healthcare in a daily practice, but also for health research, health innovation, and for public health purposes. Essentially, the European health data space has two main pillars. The first pillar concerns what we often call a primary use of health electronic data. In simple terms, the collection, access, and use of health data for the purposes of providing direct care to our patients. For healthcare professionals, the objective of this first pillar is very clear. It means that they will have better access to relevant patient information at the right time, in the right place where they need it, including also in cross-border situations, for example, and in a way that is understandable and usable in their daily clinical practice. At the same time, this first pillar of the European health data space significantly strengthens patients' rights regarding their electronic health data. It reinforces their rights in several respects. So first of all, it will improve their access, patients' access to their own health data. It will also improve their control over how their data are being used and how they are and with whom they are shared. And it will also reinforce the ability of patients to use the data seamlessly across healthcare systems, for example, where seeking healthcare from another healthcare provider. This framework is supported by stronger interoperability requirements and secure data sharing through a dedicated European-wide digital infrastructure, so-called MyHealth at the EU. But beyond very clear impact on individual care of individual patients, this will have also a very concrete impact on health systems. Better data availability and interoperability will help to reduce duplication of tests and examinations, avoid unnecessary procedures, improve care coordination, and more generally support efficient use of limited healthcare resources. So our goal is simple and very practical. Less missing information, less duplication, better continuity of care, and as a result, more resilient health systems, especially when patients move across regions or countries. The second important pillar of the European health data space goes beyond the use of data for the purposes of provision of healthcare to individual patients. It concerns what we call the secondary use of electronic health data, which in, let's say, more accessible terms means reuse of health data beyond the direct patient care for clearly defined public interest purposes. These purposes include, for example, health research and health innovation, public health and disease surveillance, health system planning, and health system performance assessment. It is closely linked also to our work on artificial intelligence in healthcare, as I will demonstrate a little bit later. So, talking about the second pillar and the secondary use of health data, what does this mean for healthcare professionals? For health professionals, this pillar is about learning from care in a structured, secure, and trustworthy way. Very importantly, secondary use under the European health data space is not about unrestricted access to data, and it is not about commercial exploitation of personal health data. To the contrary, the European health data space framework is based on strictly limited access to data only to authorized purposes granted through decisions of designated public health data access bodies, so national agencies in the member states, subject to clear conditions and safeguards, and where required, based on anonymization or pseudonymization of data. So the privacy and security of the personal data is of critical importance in this context. The European health data space in the area of secondary use will help ensure that clinical practice is informed by robust real-world evidence, that innovations are evaluated in real-life conditions, that health policies are based on outcomes rather than assumptions, and that health systems can identify what works, for whom, and under which conditions. At system level, secondary use enables a shift towards a learning health system where data generated in a routine care feeds research and evaluation, and where insights are fed back to improve guidelines, pathways, and outcomes over time. So, to summarize, the objective is to transform data into knowledge, knowledge into better decisions, and ultimately the decisions into better health outcomes. This always needs to remain in line with our shared European values of trust, transparency, and public interest. The European health data space started as a strategic vision and as a plan, but it's no longer only an abstract vision. In March last year, so almost 10 months ago, the regulation on the European health data space was adopted by the EU legislators, and we are now working at full speed together with all the relevant stakeholders, in particular with the member state national authorities, to move from legislation to concrete implementation. I noticed on the agenda of the event today that there are many sessions dealing with the topic of implementation of the European health data space later on today. But for now, I will just mention that there is one date worth remembering, and that's March 2029. This is the date when most of the provisions of the regulation will start to apply, both for the primary use of data and the secondary use of data. And this is the date when the European health data space should be fully rolled out and should become a reality. What happens between now and then is very important. Implementation of the legislative framework will bring very concrete benefits, but it will also introduce new ways of working and new obligations. This is why it is important for all the stakeholders and all actors in the field to try to stay informed about the developments regarding the European Health Data Space, especially in their respective member states and at the national and regional level. The European Health Data Space will only succeed if it works well on the ground, in hospitals, in clinics, and throughout the care pathways. And this is where healthcare professionals, healthcare providers, but also researchers and patient representatives come in. They will be not just users of the system, they will be key actors of its implementation, and their feedback, experience, and engagement will shape how the European Health Data Space delivers in practice on its objectives. Let me also clarify that the European Health Data Space is not a standalone project. It underpins most of the EU's health policy priorities and other initiatives. Let me give you one recent and very pertinent example. Take, for example, the cardiovascular diseases. We know that cardiovascular diseases remain the leading cause of mortality in Europe. We also know that prevention, early detection, and long-term management are essential, and that outcomes still vary widely across populations and health systems. This is precisely why the European Commission has recently put forward the European Cardiovascular Health Plan, that is sometimes being also referred to as the Safe Hearts Plan. The European Health Data Space will play a key enabling role in this context. It will improve access to high-quality interoperable health data, and through that, the European Health Data Space will help move cardiovascular policy and clinical practice from fragmented data to shared evidence, and from reactive care rather to prevention and long-term management. Another relevant example where the European Health Data Space support our other policies is the approach to artificial intelligence in healthcare. Artificial intelligence became a hot topic in the recent period, and there is no doubt that the artificial intelligence has enormous potential in healthcare, from earlier detection and risk stratification to clinical decision support and workflow organization. But for healthcare professionals, the key question is not whether the AI is powerful. It is rather whether the AI is trustworthy, whether it's safe, and whether it's clinically meaningful to use it. And this is the Europeans' approach to AI in healthcare, and it is very clear. The AI is meant to support clinical judgment, not to replace it. Human oversight, transparency, and safety are critical and non-negotiable. This is reflected, for example, in the EU Artificial Intelligence Act, which establishes a horizontal framework for high-risk AI systems in healthcare. But this is also reflected in our recently adopted Apply AI strategy, which focuses on the responsible and effective deployment of AI in the real-world setting. And here again, I'm coming back to the European Health Data Space. The European Health Data Space plays a central and enabling role also for the development and deployment of AI in healthcare. It fuels AI work streams with representative data and diverse health data, which are essential to reduce bias, improve reliability, and ensure that AI tools actually perform as expected in clinical practice. So by connecting the European Health Data Space, the AI Act, and the Apply AI strategy, the EU is building a framework where innovation is encouraged, but always anchored in patient safety, professional responsibility, and public trust. So let me conclude with a few important lines. The digital health will only succeed if patients and healthcare professionals see its value in their daily life. That is why your experience, your trust, and your engagement as healthcare providers, health professionals, or health policy leaders are essential. The European Health Data Space, artificial intelligence, and digital health policies are tools. The real objective is to achieve better health outcomes, safer care, and stronger health systems for all Europeans. With that, I thank you very much, and I look forward to good discussions over today. Thank you.
Thank you very much. Let's have a seat. And here's a microphone. All right, so thank you for that outlook to 2029. Concretely, what do people need to do until then? What is the best way to prepare? Having you as an expert here, what can we do?
Thank you very much. Yeah, that's a very important question. I think when you are asking what the people need to do, we need to distinguish between the different people. So I will start. I will take it one group by another. Very important and busy period is coming for the national authorities. They need to transform, let's say, the legal obligations and legal text in the EHDS regulation into the real life. So they need to ensure that their national systems comply with the obligations set out in the EHDS regulation. So we are working very closely with the national authorities and agencies to do that, and we are supporting them through different means, financially through funding different projects, but also through bringing them together and providing a platform for them to exchange their experience and knowledge from the national context. But there are also important things that other stakeholders need to do. So starting with the healthcare providers and health professionals, as of 2029, they will be able to access the patient data in the harmonized European format, which will facilitate their daily work significantly, as I explained. But it will also require certain preparation within the healthcare providers for that change to start. So, and we are also having projects at the European level supporting that, awareness raising, trainings, capacity building.
Is that mainly on the IT side of things, or what is it concretely?
It is both. I mean, on let's say adjusting to the European Electronic Health Record Exchange format, let's say on the technical side, but also to make this useful and usable for the healthcare workforce and healthcare staff. So there is a need to work on, let's say, increasing the awareness and training and capacity building also on that side. And finally, I would also probably mention in the area of secondary use of data, so not in directly providing healthcare to patients. Some of the actors in the field will become what we call health data holders, electronic health data holders. So under the regulation, they will have an obligation to at least make public what types of data they're processing, so to facilitate searchability of this data for example, health researchers. And then if the health data access permit is granted, they will need to provide access to this data in specific situations.
You mentioned training opportunities. Specifically, if someone wants to be ahead of the curve, how do they do that?
At the EU level, we are trying to support all this process, but we need to bear in mind that primarily, the responsibility for organization and especially funding and financing lies with the member states. So the tools that we have available at the European level are not unlimited; they're rather restricted. So what we are trying to do is to provide, let's say, a guidance and support to the national authorities, for example, for developing training toolkits, communication materials, communication toolkits, but then we rely, and we will need to rely also on the activities at the national level, so by the national authorities, but also, for example, by the support by professional organizations and representatives of health professionals, healthcare providers, and also patient representatives.
So this will take the whole ecosystem to really succeed.
Yes.
Well, good thing we're at the ICT and Health World Conference, where the whole ecosystem converges. Maybe sort of a last word drawn on your experience. you have this beautiful position of really being able to see what's working in different countries and then always thinking about how can we scale essentially what's working. What are some of the success factors you've seen, sort of looking back, perhaps, on really enabling this learning from each other across regions, across cultures, across professional roles?
Yeah, no, you're right that, let's say, the level of readiness or digital readiness across the healthcare systems in Europe is different and varies country from country. Some countries are already quite advanced. Some of them are only starting, which brings both. Situations bring positive and negative sides. If you're starting fresh, there is a lot of work ahead of you, but you can really construct everything properly from the day one. If you're already, having a system that is working in a way, and you need to slightly readjust it, sometimes this may become even more complex or adds additional complexities. But in terms of the factors that are important, what I would mention in the first place is an early involvement of the relevant stakeholders and stakeholder groups in designing the systems. Because as I said in my introductory remarks, at the end of the day, what we want is that the systems that we put in place work for health professionals, for doctors, nurses, midwives, and eventually also for or result in improved patient outcomes. So they work also for patients. So getting input and views from all the stakeholders very early in the process is very, very important.
Thank you very much, Martin Dorazil. Ladies and gentlemen, thank you so much. Yes.